here's the Health Ministry Week in Review. This week, we continue to advance health services nationwide. On Saturday, residents of Sophia and All Boys Town turned out in large numbers to receive and utilize the Government of Guyana's eye testing and spectacles vouchers, valued at $2,000 and $15,000 respectively. The Honorable Minister of Health, Dr. Frank Anthony, was present at both locations, interacting with residents who expressed their gratitude for the vouchers and the convenience of having these services delivered directly to them. On the same day, a team of specialists from Georgetown visited Kurukabaru village to distribute eye testing and spectacle vouchers, as well as cervical cancer screening vouchers valued at $8,000. Dental and oral services were also provided to those in need. Over 100 residents benefited from this outreach. Meanwhile, on Sunday, Minister Anthony participated in the Amerindian Heritage Fitness Walk from Umaniyana to the National Park Commission. In his remarks, he praised the organizers and urged the public to use the Ministry of Health's free vouchers for eye testing, spectacles, and cervical cancer screening. On Monday, September 9th, Minister Anthony received a donation of communication materials from UNICEF, supported by USAID, for distribution to community health committees in Region 9. These materials will promote health education on nutrition and other health-related topics. Thereafter, Minister Anthony commissioned the Swan Health Center along the Linden-Susdike Highway, which was constructed at an approximate cost of 20 million Guyana dollars. The center is equipped with medical supplies, staff, and resources to provide primary healthcare services to residents. To mark the opening, the ministry partnered with optical facilities to distribute and utilize eye testing and spectacles vouchers. The minister noted that the center will offer maternal and child health services, including vaccinations and MCH clinics for pregnant women.
Now, with this facility, you heard MEDEX and the RHO talking about the services that we'll bring here. And among those services would be to ensure that you have a regular vaccination for the children and what we call MCH clinics, making sure that pregnant women get all the care that they need. So I would like to see that on a regular basis, that we have a doctor would come to the clinic and they will tell you every month when they will come, so that the older people in the community can come here and get that service.
On Tuesday, the Ministry of Health's Mental Health Unit, in collaboration with the International Development and Relief Foundation and the Ministry of Education, held a suicide awareness and prevention workshop to mark World Suicide Prevention Day. In keeping with this year's theme, Changing the Narrative on Suicide, the workshop emphasized a holistic, multi-sectoral approach to promoting mental well-being. Approximately 86 participants from Central, Upper, and Lower Quarantine in Region 6 attended, including teachers, guidance counselors, healthcare staff, and community leaders. In observance of this day, Minister Anthony, in his message to the nation, highlighted the Mental Health Unit's collaboration with the Ministry of Education for activities in Regions 3 and 4. He noted that the ministry remains committed to a holistic, collective approach to suicide prevention and mental well-being in Guyana. Meanwhile, on September 11th, Dr. Karanjit Kuner, a glaucoma professor from the World Eye Mission, and Dr. Sailendra Sugram, consultant ophthalmologist and head of the ophthalmology department at Georgetown Public Hospital Corporation, visited the health minister to discuss strengthening the health sector, particularly in ophthalmology. Later, the minister met with the Cuban ambassador, George Francisco Soberon Lewis, and his team to explore potential collaboration on high-priority projects in vaccines and pharmaceuticals. This concludes this week's review. As we prepare to observe Caribbean Wellness Day on September 14th, let's embrace this year's theme, Powered Through Collective Action, with the sub-theme, Good Health is Our Right. Together, we can build a healthier future for everyone.